Today I have Dr. Amir Karam with us, who is a facial plastic surgeon specialist. He is a doctor at UCI and is here today to talk to us about Botox, Restylane, and other facial procedures. Welcome, Dr. Karam.
Thank you very much, Don. I appreciate the invitation.
Thank you for coming today, and please tell our viewers about your background and why you chose to specialize in facial plastic surgery.
Okay. Interestingly, during medical school, it was actually in the first year of med school, I was sitting there in a lecture during anatomy, and one of the fellows who had finished a facial plastic surgery fellowship recently came and gave a clinical correlate showing what the diseases that manifest the face and some of the surgical procedures that can be done to correct them. And this talk just totally blew me away. It was on 2 screens that had these elaborate anatomic dissections that showed these major defects that have been created either from trauma or cancer or some other thing. Wow. And watching these surgically be fixed or reconciled was just very inspiring for me. And so from that point on, I got interested in it and started doing some investigation into the field of facial plastic surgery and started getting involved in some research, and by the time medical school ended, I kind of knew that that's the direction I wanted to go.
Wow.
Yeah.
Now, I know I had met you at Kaiser, and you are an actual ENT, correct?
Yeah, that's what I did my residency in.
Okay. And to specialize in in facial plastic surgery, you are actually doing that at UCI.
That's right.
And what procedures are actually currently being done in your industry, excuse me, and what is the most popular, I guess I would ask you?
Most popular procedures? It's a tough question because there's so much that's popular nowadays, and that's the real sort of beauty of the field right now, is that there's so many more options that are available today than there were 10, 15 years ago. Patients who wanted to come, for example, for rejuvenation type procedures, all they would have as a surgeon to be able to offer them mainly was a facelift, for example, or eyelid surgery or brow lift. Today, with Botox, Restylane, just to name a few, fat transfer and all these other things, in conjunction with the more invasive surgical procedures, gives the patients a lot of options, gives the surgeons a lot more arsenal to be able to deal with some of these problems, and just make the entire field a lot more colorful and interesting.
Now, I've had Botox done, I've had Restylane done, and I loved it when I had it done. Yeah. The only effect was I didn't like that it didn't last forever. So, on Botox and Restylane, expand a little bit more on that. What's the expense? I can't speak here. What's the expectancy on Botox and Restylane? How long does it usually last?
Well, the issue of it not being a permanent solution and having a temporary effect is actually as much of a pro as it is a con. The thought is that, if you get an effect that you don't like, because it really is changing the shape of your face, you get an effect you don't like, you know in the back of your mind, and in reality this is only going to be a short-lived thing, 3 months, 4 months, or maximum 6 months before it happens. So you can alter these changes, and you can continue to evolve your procedures to be able to continually change as the patient's face changes. As you know, we're constantly aging, and the dynamics of our face is changing. If you do something permanent in there, for example, if Botox were permanent, and you get an eyebrow on one side that's raised a little too high, or a wrinkle that is more exposed, because then at that point you have no options. The nice thing is you can come back and change that up a little bit and improve. Now, the downside, of course, is that it costs a lot for the patient to have to continue that, and that's the part that certainly stings for patients, not just when you're doing the injection, but also in the wallet. And but nevertheless, it's actually one of the most powerful tools we have in terms of being able to sort of prevent a lot of the aging changes. And a lot of dermatologist colleagues of mine who've been introduced to Botox early have been using it straight for 8 years, 9 years now. And the reason is because the way the Botox works is it keeps the muscles from moving and creating their effect on the skin, the underlying muscles. So by using the Botox, you can prevent the long-term changes on the skin, specifically wrinkles across the skin. So by using it, you're preventing these things from happening.
Really?
Yeah.
Okay, a question on that, because when I did have Botox done, I did like the effect that it didn't move and I didn't have the crinkle and all of that. But I felt that maybe I had another line appear. Is that just me, or can that really happen?
It can happen, and that's again goes back. Well, there's two things that could either be happening. One is that line was there before, but it was being covered up or sort of masked by the underlying muscles. They were changing the surface of your skin, because the underlying there's a dynamic wrinkle and then there's a static wrinkle. The dynamic means that it's related to muscle movement. Static means that it's there just because that's the intrinsic sort of nature of the skin. And the Botox works on the dynamic. So if you take that dynamic motion of the muscles out, you will potentially unmask some of those more static wrinkles that you may have noticed in various parts of your forehead or around your eyes.
Now,